So you guys asked for a video about books and other resources for first year of MBBS, and here it is. So I'm gonna get right into it. Let's start with the hardest subject, which is anatomy. Most people get supplementary in this subject itself. Anatomy depends on how much time that you actually are willing to spend for this. If you have about 1 year from your university exam, which means you're starting MBBS just now, then the plan is going to be a lot different from if you just have 1 month left for your exams. So I'll cover both of those in this video. Let's assume that you have 1 year left for your anatomy university paper. So what do you actually have to do right now? Right now, focus on completing your reading. So I would tell, as far as books are considered, focus on Vishram Singh or BDC. Either one, not both of you. These books are actually really good. You don't have to go for international books like Grey's Anatomy. Grey's Anatomy is very vast and that is not actually required. The main thing that I want you to focus on is diagrams. Make sure that you are having a separate notebook where you draw each and every diagram of a chapter. So as the chapter is covered, just draw those diagrams by hand into a notebook, because these are what's gonna fetch you the most amount of marks. Whenever a professor is checking your paper, they just see the diagram and then they put the marks immediately. So a 5 mark question, they just see the diagram and 3 marks is already covered by that. The rest 2 marks is based on your labeling, the things you put below the diagram, the things you write. They don't even actually look at the things you write, they just look at the subheadings and put marks. So I just want you to focus on the diagrams. Make sure you make colorful diagrams for each chapter. It's going to be in the book itself. Whatever diagrams in the book, you just copy it by hand a few times, basically practice drawing it without looking at the book. Another very important thing in the books that's given is clinical application. So every time someone is checking a paper, they're always going to look at the end of your answer whether you've written clinical application or not. So these are very small points but they carry a lot of weight. These are usually given in that boxes in Vishram Singh. So just have a look at those. In each chapter, make a list of each clinical significance thing that is there in each chapter and actually go through the tests. Like search up a YouTube video on how to do each of these tests, because in vivas they can actually ask you, show me this test, what is this sign used for? All these kind of questions can be asked in viva. So it's not just about theory exams, viva also matters. Now coming to the embryology part. Embryology, actually the way to study it is based on each week. Each week different things will happen to the embryo. I just want you to make a list based on the number of weeks. So week number 1, what happens? Week number 2, what happens? Just make a list of all the things that happen in each week of development. And also take Vishram Singh embryology book. Just look at the diagrams. See the most important diagrams. So if let's say they asked a question about one specific topic, think of which diagram you would want to draw for this, an easy diagram. Consider, let's say, diaphragm development. So for diaphragm development, there is one easy diagram where there's the 4 parts of diaphragm developing, and you can just draw that, and that's it for the answer. Have that in a different book. So copy those, draw those into a different book for each chapter in embryology, along with the week by week what happens. So for the books, use Vishram Singh Embryology, and for reading embryology further, you can use Langman's Embryology. These have a bit more detailed stuff about why each thing happens. But as far as exams are concerned, embryology doesn't have so much weightage, so you can just read Vishram Singh and go. For histology, I would tell focus on the diagrams itself. Anatomy is all about diagrams. So even in histology, there's going to be different patterns that you see in a diagram. So whenever you see a histology specimen, see what kind of diagram it is. Consider a GI specimen. So in GI, obviously it's going to have these 4 layers, this mucosa, submucosa, muscularis and serosa. Whenever you draw it, just see what are the differences in each layer that's happening to each specimen of GI. Some might have a layer missing, like gallbladder will not have a submucosa. So I want you to remember those things while drawing the diagrams. The diagrams and labeling will take you like 60-70% of the way there. The rest is just about clinical significance. So these are the things that you need to do for anatomy. So if you only have 1 month for your university exam, all I would say is you can skip a lot of stuff, focus on the diagrams and the clinical significance. This will fetch you the maximum amount of marks. See a chapter, draw all the diagrams into a notebook, practice those without seeing, and then clinical significance, make a list. Try to remember them just by seeing the name of the clinical significance and correlate that with the diagram. This is it for your university exams. If you just have these 2 things, that's going to take you a long way. Make sure you know how to label the diagram as well. As far as writing is concerned, you can just write whatever you want. You can just write it below the diagram. Make sure you have neat subheadings, because the examiner is just going to read the subheadings and the diagram, that's it, and the clinical significance. They're literally looking for that thing at the end of your answer. So make sure that is there. Okay, coming to physiology, the one thing I want to say for physiology is, like how diagrams are there for anatomy, flowcharts are there for physiology. The moment an examiner sees a flowchart in your answer, means you're going to get good marks in it. They just want to see the flowcharts, we see the lines flowing, see things connecting, and they're like, okay, he knows what he's doing. Physiology, the knowledge itself actually is the same as your NCERT knowledge. So if you've read your NCERT human physiology, it's the same thing. So these questions are actually quite repeated in physiology. So make sure you focus on these previous year questions. Have a look through previous year questions, see what topics are being repeatedly asked. Chances are they're going to come in your exam as well. As far as books are considered, for these flowcharts, we have a book called G.K. Pal. He's a professor from JIPMER. So we use those books and just copy paste those flowcharts. In each chapter, there might be like 3-4 flowcharts. We just write those flowcharts in our own notes, and then we just copy paste that in the university paper, and we get marks. For your reading, I would tell read Guyton. Guyton is really good for your reference. If you are having 1 year for your whole reading, you just try to finish Guyton and make a flowchart notebook. This will be enough for physiology. Physiology mainly focus on the flowcharts and the side headings. So make sure you have a big bold subheadings. They're just going to read the subheadings. They're not going to read the what's inside the subheadings. So whenever a topic is asked, at least know the subheadings, even if you don't know the content. And at the end of this video, we'll give you a list of YouTube channels that you can watch for each subject. So stay tuned for that. Now coming to biochemistry, this actually heavily depends upon the time that you have. So biochemistry is actually quite vast. Here the 80-20 rule actually breaks down, because in biochemistry you need to know almost everything. There is no skipping things. If you skip something, you're just gonna have a huge hole in your knowledge. I would tell biochemistry focuses mainly on the cycles, metabolic cycles. You can read these from Lippincott. Actually, Lippincott gives these cycles pretty neatly. So have a notebook of cycles in the metabolic cycles in biochemistry. Keep that separate, keep revising that. And I actually read Vasudevan. So Vasudevan is a very comprehensive book. If you have time, just finish reading Vasudevan from cover to cover. Literally just read, highlight everything, and you will get good marks in biochemistry, provided you revise that again and again. Because it's given very simply, there is no extra stuff. Like everything that's going to be asked in exam is just covered in Vasudevan. So you can read that. If you want a shorter cycles only notebook, you can just go for Lippincott. Lippincott gives this especially carbohydrate metabolism. It's given pretty good in Lippincott. If you don't have time, then another alternative is the Jambhulkar sir's short notes. These cover most of the important questions in his notes. It's quite concise, and you can just read that before exam, 1-2 weeks before exam. This will guarantee you a pass at least in the exam. But if you want good marks, I would tell read it completely, read it thoroughly, because it's one of those subjects where it's not really up to interpretation. It's just if you know the answer, you're going to get the marks. That's it for biochemistry. Coming to the final part of the video about online resources for MBBS first year. First of all, anatomy. Anatomy, there are some really good lectures by Dr. Ashwini Kumar. Just have a go through each lecture before the DH or before your theory classes. For your 3D images, just go through kenhub.com. They have really good 3D images where you can visualize each structure and see them just before going to DH. If you just see these structures and then try to look for it in the dissection, you will be able to see them much better. Then on to physiology. I would just say, just see Ninja Nerd's videos. He has posted almost all the things in physiology and he's covered it in very detail. Just watch those videos and your concept will be crystal clear. Now on to biochemistry. There's no doubt. Just watch Jambhulkar sir's videos. He covers all the topics in biochemistry pretty cleanly. You can just watch those. Now some people have asked me whether you should buy these coaching institute things like Marrow, Prepladder, all these things. I would say it's not needed in first year because textbooks are enough. You will learn a lot through textbooks and your dissection, your practicals, all those things. So you won't really have the time for your coaching institute resources. and they're not necessary in the first year. So if you're planning to buy them, I would tell just buy them in the second year or third year if you want. This video covers all the resources for your academic purposes of first year MBBS, but some more things are left unsaid. Just watch our previous video which we covered all the first year essentials, so don't miss out on those. That's it for the video. See you guys in the next video. If you have any video recommendations that you want us to post, just put them down in the comment section below. Like and subscribe. Thank you for watching.